This is active hip flexion work with a passive range hold as well as PAILS rails to gain more range of motion in your active hip flexion as well as control within that newly acquired range. So we're going to do this supine on our back. So go ahead and lay down on your back, and we're going to bring our right knee in towards our chest, and you're going to pull it in as tightly as you can, and then we're going to extend our left leg forward, okay? It might feel difficult for you to extend this leg forward. If it feels like it's lifted, just know that you need to work on opening this hip flexion on this opposite side. Okay, you can prop your leg up if you need to. We will be driving this leg into the floor for this work as well, so we're working in opposition. So left leg is working into extension, right leg is working in towards hip flexion. So you're gonna pull it in, compress your thigh to your rib cage, and we're holding this stretch. So we're gonna hold this for another minute. Okay, so pulling that knee towards your chest, actively drawing it in, draw your shoulders down, so compressing into that hip flexion. So we're doing a passive range hold to work on increasing this range of motion here. You may feel a stretch on the back side of that right leg and into the hip. If you're someone that already has a good amount of hip flexion, you can just skip right forward into the PAILS rails. The work of holding these passive ranges is to increase your range of motion here, okay? So we have a little bit more time. Take a few big deep breaths. We're gonna work into PAILS rails. So when we do the PAILS, we're going to be pressing our leg forward as if we could kick it all the way forward. However, our arms are not going to let our leg get there. So we are resisting with our hands. We're continuing to hug that knee in towards our chest as we kick that leg away from us. Okay, that's the first work. We're gonna increase the intensity slowly, build up over time, and then we're gonna do the reverse. We're gonna actively draw our knee towards our chest, and then just to make sure we're not using our hands, we're gonna remove our hands and try and maintain that. You may feel some cramping in the front of that hip joint, okay? Do your best to back off just to the edge of that cramp. It's totally fine if you do cramp. That's just your nervous system responding and telling you that you don't quite have that range of motion or the control of that range of motion quite yet. Okay, so we're gonna start our PAILS contraction. Start to kick that right leg forward. Again, it's not going anywhere because we are blocking that movement with our arms. We're gonna irradiate tension through our body. Start to kick forward about 20% effort, 30% intensity. I want you to hit every number in between, so 32, 33, 34, 40%, just slowly ramping up, 50%, keep kicking forward, 60%, you should feel the glutes, hamstrings, back of the leg, 70%, 80, you might start to feel your body shake. Greatest, safest effort, work hard, hold this for 10, 9, 8, 7, keep your core tight, 6, keep your opposite leg driving, 4, 3, 2, now actively pull that knee towards your chest using your hip flexors and core. Slowly release your arms, engage and irradiate tension, hold it. We're minimizing the lag of that leg as we release the hands. 8, 7, 6, keep hugging it in tight. 5, 4, 3, 2, and re-grab the leg, hug it in. Take a couple deep breaths, and we're gonna do that again. Okay, hold that stretch. So if you notice when you started to actively pull that knee towards your chest and then you let the leg go and your leg kind of slingshotted away from your body, that means that you have the ability to passively pull your knee towards your chest, but you don't have the ability to actively pull that knee in towards that space. So the difference between your active range of motion, which would be here, and then your passive range using support to pull it here, there is this gap. So with this work, with the PAILS rails, we're trying to close the gap and regain the control of the range of motion from here to here, okay? This gap is where injury tends to happen, or where asymmetries happen, or insufficient movement can happen, dysfunction in the body. Okay, this is a dysfunction right here, our gap between active and passive. So round 2, starting to kick that leg forward, 20%, 30%, 40%, hitting every number in between. 50, keep ramping. 60, 70, 80, your greatest, safest, hold it for 10, 9, 8, keep working hard. 7, 6, 5, work the hip. 4, work the hamstring. 3, 2, actively pull the knee to your chest. Try and minimize the lag. Release your arms. Hug it in tight for 10, 9, 8. Feel that core. Feel that hip flexor. 3, 2, and re-grab the leg. Hug it in tight. Take a deep breath in. Deep breath out. Deep breath in. Deep breath out. Let's take one more breath. We'll do one more round. Deep breath in. Softening the tissue. Deep breath out. And then last round. Hug it in tight. Kick that leg away. 20%. Irradiate tension in the body. 30%. 40. 50. 60. 70. 80. 90. Your greatest, safest effort. Work hard. Hold it for 10. 9. 8. 7. Don't let that leg move. 4. 3. 2. Actively pull the knee to your chest. Remove your hands slowly and hold for 10. 9. Drive your arms down. 8. 7. 6. 5. 4. 3. 2. And re-grab the leg. Take a deep breath in. Deep breath out. Soften into that hip joint. Deep breath in. Deep breath out. Again, deep breath in. And deep breath out. And slowly release that leg. Allow the leg to straighten out. Good. Feel all the heat in the front of that hip flexor. And then we'll draw the left knee in towards your chest. And you'll repeat all of that work on the left side.